This is Chapter 13, Part 2, Health Promotion of Toddlers and Preschoolers, and we were on child abuse, and a specific type of child abuse is shaken baby syndrome. It has other names it can go by, which abusive head trauma is one of them that our book uses. And what this is a child being vigorously shaken. And the reason this does such damage is a child has a big, heavy head compared to their body and very weak muscles in the neck. So as the chest is shaken back and forth, the head is swinging much more violently than the body. And the brain in a baby has a lot more extra area around it, so the brain can move inside the skull, and then as the head is starting to go back, that brain's still going forward and it smashes into the skull. And then it bounces backwards, and at the back, the head is starting to go forwards and the brain is still going back. And so you get this banging of the brain into the skull, and it's sliding around. And deep down at the brainstem here, you've got structures that you get shearing forces, and you get lots of tearing of little blood vessels. So what we see is intracranial bleeding. The other vessels that tear are in the retina. So you'll get bilateral retinal hemorrhages. And there really is nothing that causes bilateral retinal hemorrhages other than shaken baby syndrome. If you have a trauma, it's usually one eye, not this, bilateral bleeding in the eyes. And usually there's no other physical signs. If they're being abused in other ways, there may be, but from the shaking, you don't see anything. It's just the brain trauma and then the retinal hemorrhages. These kids do not do well. 20 to 30% of them die from being shaken, and even those who live, many will have devastating lifelong deficits. This is a picture of the retinal hemorrhages. So you can see it's not just one place, but multiple little burst vessels all over. These are all burst vessels. That's a pretty big one there. And you'll have that in both eyes. Munchausen by proxy syndrome. This is a parent who is fabricating illnesses of their child in order to get their own needs met. So they come up with some illness or problem, get their child hospitalized or procedures ordered, treatments done that are not necessary. So this is a parent who has an emotional issue, and they're using the child's illness or fabricating an illness or a problem to meet their own needs. 10% of these cases can actually be fatal. So that's a very sad one. So what predisposes somebody to abuse? Well, we know this is not an absolute, but there is a more likely parent, a young parent. So age matters. Younger, they just haven't developed the coping skills to deal with parenting. Young and single, and especially if there's unrelated partners in and out of the house, the unrelated partner is often the abuser, or just makes the incidence of abuse happen more, makes it more likely. This parent also has low self-esteem, very poor parenting skills, and poor knowledge about parenting. And they didn't have a role model, their own parents were poor parents. The child who's most likely to be abused, now again, this is not an absolute, but most likely, it's under a year. Those infants just take more work to care for, and somebody who doesn't have coping skills or parenting skills, they can lose it. Children who have extra needs, whether it's physical disabilities or they're hyperactive or they're premature and have medical needs, they also are more at risk for abuse. And then it most often happens in an environment where the family is socially isolated. There really isn't a support system for them, and they live in chronic stress. Usually poverty will contribute to that. Substitute caregivers, so they're having to send the child here and there. They don't have, that support of a place for the child to go. All of those things just predispose towards an abuse happening. But again, it's not an absolute, and it doesn't mean a family that doesn't fit that description isn't abusive. Sexual abuse. This is when you use or persuade or coerce a child into engaging in sexually explicit activity, or videoing that visual depiction of that. So it can be raping or molesting a child, forcing a child into prostitution, having incest with a child, exhibitionism, which is exposing oneself to a child, child pornography and prostitution and pedophilia all fall under sexual abuse. Characteristics. There is a most likely scenario. It's usually a man, most often a man, and it's usually someone the victim knows. And that the abuser kind of manipulates the child into not telling, scares them, tells them if they tell they're going to get taken away from their family, so they manipulate them and make the child not tell. It can happen at any socioeconomic level. Most of the time we're talking about adults, and most of the time we're talking about males. And it's often multi-generational. So someone who was himself a victim of abuse, of sexual abuse, will then sexually abuse a child. So, how do we take care of the child who's been maltreated? Well, our first goal is to get them out of the situation as early as possible. Realize children love their parents. They want to be with their parents. So often the first thing we have to do is get them out of that situation. But that may not be permanent. If we can get the family the support, the help that they need, and kind of monitor things and put the child back safely, that really is what the child usually is going to want. So we do have to get a detailed history from the child. We usually have to do physical examination of the child, and both of those can be very emotionally trying on the child. So we need to make sure we're being emotionally sensitive to the child during that. And then we're looking for evidence of this maltreatment happening. Usually there's a combination of indicators. There's not just one thing. So when you are just getting those red flags, start looking at what is going on, what's making you uncomfortable. A big one is when the child and the caregivers give different stories. The stories don't match. That's a big red flag. Inconsistent or incongruent behavior. So the parent is saying they're so upset, but they don't look it, they don't act it. They're not very engaged with the child. They're blaming the child for falling down the steps. They're yelling at the child for being clumsy rather than being concerned. Any one thing by itself may not be it. Some of us just respond poorly when we're under stress. But when you start putting all the pieces together, and then if the injury doesn't match the story, that's when we really do want to do a report and get CPS involved. So our goal is to protect the child from further abuse. If we can get the family the help they need, the parenting training, the support, that is where the child wants to stay, if at all possible. Not always possible, but that is going to be the child loves their parent naturally, and they would like to stay there if we can make it a safe place for them. If you happen to be the one a child says, I didn't really fall down the stairs, Daddy pushed me, you are a mandated reporter. You need to report that. You need to call Child Protective Services as soon as it is feasibly possible, and they will kind of talk you through making that report, and then you have to follow up with a written report. I believe it's in 24 hours, but it might be in 48 hours. But they will tell you that as you make the report on the phone. So you are a mandated reporter. If something should happen at Children's Hospital while we're there, the social workers like to be involved. They wouldn't want you making that report just on your own. They would want to come in and help you through making that report, so you wouldn't be on your own doing that. And that's the end of the chapter.